every other child up to the point where typically when they're about ready to go to preschool or kindergarten, kids can be pretty blunt when it comes to differences of any kind, especially facial differences. So we try to pay special attention to our kids and families when they're getting to be school-aged. And we love for them to just sort of own it, I guess is how people describe it. So yes, this is how I'm different, but, I'm not less than. And so we try to, we do little things in the clinic as they sort of approach that age. We talk to them, not just to mom and dad. We're very open about anything you want to talk about. Does this bother you? Does that aspect of how your lip looks or nose or whatever? Just basically things to foster the kind of relationship where if they're feeling it, they feel safe to say it. And that happens in our clinics too, with our social workers that are part of our team, so that we can connect them with psychosocial counseling at any age, and the parents too, if they need it. So that's part of it. They go from these kids that, like I said, don't know that anything's different, and they're kind of happy-go-lucky, and then we're sort of all aware of, potentially anyway, it doesn't happen all the time, of a time when they start to see themselves through other people's eyes. And so we're kind of try to be predictive or aware of when that shift happens, and then sort of guide them through that. And then as they get to sort of middle school, high school, most of them have sort of figured that out. Some of them are just then dealing with it, and that can be a lot of where the time is spent with the patient, honestly, in those age ranges. Yeah, we can talk about the surgery, and there's a few things to know, but those kids are tough. They start out having to have these procedures and recovery, and so the details about the procedure and the surgery are just those. They're details, but how are you doing? What's going on with you? You're going to be out of activity for a little while. When is the best time, do you think, to do the surgery? So we do try to use opportunities where the treatment can be tailored to fit the patient as best we can. And that sometimes includes just taking a break. Sometimes these kids just need the braces to come off for a year. They just need to be kids. They just need to be on the gymnastics team and not worry about taking time off to recover from a surgery. And obviously we want to know that it's not going to negatively impact their care, but we're also aware of the fatigue that sets in if they have to have another procedure or a revision of one they thought they were done dealing with. So I think that sort of that psycho-emotional sort of awareness of where they are just as kids and then young adults and then adults is important, but through the lens of what they've been through and maybe what still had to tackle as a team. I think the changes that get touched off in someone's life when they start this early on with challenges has a lot of levels to it. I think what gets the focus early on is the physical change, right? This happens when obviously the children are infants and they have no idea that they're any different from any other kids. Everyone else does, right? And so I think the physical manifestation of change is the first part. But then as you get to see these children at different stages, and the surgeries are very episodic. So I mentioned that there's a lot of surgeries in the first 18 months to 2 years, but then there's typically another one 4, 5, 6 years old, sometimes 8, 9, 10 in that range, and then as teenagers, and then as young adults. And really the adult cleft patient has been a big growth aspect of our clinic as well. And so I think at all these levels, when you can influence these changes, and some are big and some are small, and you see the response that it has, and how the patients kind of carry themselves before and carry themselves afterwards, is a reminder that when we are treating these patients, we're treating the whole patient, not just treating the jaw or the lip or a scar or what have you. This is something that, because it's the face, I think is the biggest thing. I think it's because that's how people interact with the world. The world these days is not getting less focused on aesthetics, and so I think to bring them along towards a path where they feel progressively better and better and more confident about how they go out into the world is an amazing thing to be a part of.